Okay, Amy, I'm going to put some gel on your neck.
Okay.
What the gel is for is to get rid of the air between my ultrasound transducer and your body. Sound waves go very, very slowly through air, so unfortunately without the gel to get rid of the air, we don't actually get a picture. Are you able to see the screen?
Mm-hmm.
Okay. What we'll do is we're going to follow your carotid artery through the neck to look for blockage. The carotid artery is here. Your jugular vein is here. We'll follow the carotid up, and we'll see it split into two vessels. This is the external carotid artery. This delivers blood flow to the muscles of the face. This is the internal carotid artery. It delivers blood flow to the brain. We'll follow this vessel in a couple of different sections. This is called a grayscale section, which shows us cross-sectional anatomy of the vessels in your neck. The color flow that you see shows blood flow moving through the vessels in the neck. We'll follow that all the way up to your jawline. So now we're moving through in a longitudinal section, so as if we were cutting the vessel from head to toe. And we can follow this vessel through the neck, and again we can watch them split apart.
And the different colors are...
The different colors indicate what direction blood flow is moving, whether it's moving toward my transducer or away from my transducer.
Okay.
In this case, red blood flow is moving away from my transducer. Blue blood flow is moving toward my transducer. And what we look for is blockage along the artery walls, especially where the vessels split apart.
And you said it's more likely to collect there?
Yes.
Because of the anatomy?
If you see the different colors at the bifurcation or the split of those vessels, you can see how there's red here and blue, and what that's caused by is swirling blood at that level. Anytime blood flow travels through a tube that's not the same diameter the whole way through, or it splits into different vessels, there are what we call small eddy currents, which can spin around. The blood flow spins around at that level, and it causes a place in the vessel where the vessel wall may become slightly damaged, and that allows a place for plaque and cholesterol to seat and blockage to begin to form.
And what might be some of the symptoms that would lead somebody to have this test done?
If you are diagnosed with, if you present with symptoms such as dizziness, blurred vision, headaches, lightheadedness, a weakness or numbness in arms or legs, fingers or toes, patients who have difficulty with memory, again, in certain cases it can also be caused by blockage in the arteries in the neck and limiting blood flow to the brain. So those are the main things to look for. Okay. So what we'll do now is take a velocity measurement in each of these vessels. We'll begin in this case with the internal carotid artery, which is the one that leads blood flow to the brain.
And you're actually measuring them?
Yep. Going to check the velocity. It works a little like a radar detector. We send the sound waves in along this line. As the sound waves strike the red blood cells moving through, they bounce back, and they give some information on how fast the red blood cells are moving through that area, just in general terms. Again, exactly the same as a radar gun that a police officer would use to check the speed of a moving car.
Mm-hmm.
And then we measure the speed of the blood flow through the different levels. And it tells us exactly how fast the blood flow is moving at each point within the vessel. We also look at the vertebral artery, which is located here to the side, and we can see the vertebral artery coursing through the spine. These are called the spinous processes of the vertebrae. Unfortunately, with ultrasound, bone is very, very hard and causes complete shadowing of the sound wave. So anytime ultrasound encounters a bone, again, gives me a shadow. However, soft tissue can be easily imaged. And check the direction of flow in the vertebral arteries to make sure it's coursing toward the brain and not away from the brain. If it's moving the wrong direction, that can tell us about a blockage down below the collarbone on one side or the other that may also be limiting blood flow that actually reaches the brain.
And you have to do both sides, like you could have one side look normal and one side be blocked?
Exactly, yes. Okay, so take a look at this side. And the technologist will use different views to look at the vessel. The most accurate way to do an ultrasound is to look at vessels from several different views and then compare the views obtained from each position.
Yeah, it's actually, it obviously doesn't hurt at all. It's kind of relaxing. And there's really not even any pressure. You can touch real lightly, and still
Yes.
get what you need. And when you do one of these, does this get sent away then for some, like, do you talk to the patient right there, or do you
the vascular surgeon does the official reading. Technologists take the pictures if technologists are trained to identify critical findings and relay those findings to attending physicians and vascular surgeons. But the official reading comes from the vascular surgeon after all of the study views are viewed once we get back to the lab after a screening.
So people shouldn't expect to get any diagnosis or anything right there?
No. What will happen is they'll be sent directly to the patient's home for our screenings. Abnormal findings will, in addition, be sent to the patient's physician. Typically, patients over 50 years of age. We are looking for mostly patients who have some sort of risk factors, which could include high blood pressure, diabetes, high cholesterol. Family history of blockage is another one that we sometimes identify patients with. Smoking is by far the largest factor that we have to look at when we look for carotid blockage, no matter what the age.
What does smoking do?
With smoking, what happens is the nicotine in the cigarettes actually causes an irritation of the artery wall, which in turn causes cells which normally lay nice and flat to become somewhat distorted. Whenever the surface of a vessel becomes roughened, it allows place for cholesterol, plaques, fats, calcium to begin to collect, and once it begins to collect, then it tends to build. Okay. Quick peek at the vertebral artery. It's going in the right direction as well. Very good. Okay.